computer says. So as soon as that is loaded, I'll do our introduction.
Okay.
Hand the reins off. All right. Looks like that is live on Facebook now also. Good evening, everybody. Today we have two special guests to talk to us about anxiety, attitude, and art, and some destigmatization in the world of mental health. Our speakers today will be Amy Barton. Amy is a Florida native and went to the University of West Florida, where she graduated with her bachelor's in psychology. Then in 2011, moved to the Ozarks and worked as a social worker, then going on to get her PhD at the University of Missouri. That was research on autism and memory. She's also taught several classes on biological psychology. Sorry, I'm getting a little tongue-tied with my words here. After grad school, Amy worked as a research specialist at the Thompson Center for Autism, and then came to Northwest Missouri State University in 2019, where she teaches biological psychology, psychopharmacology, and among some other courses. Thank you, Amy, for joining us today.
Thanks for having me.
And our second presenter is going to be Elizabeth Dimmit. Elizabeth has her master's in counseling psychology and is a senior instructor for Northwest's Division of Behavioral Sciences. She also is a licensed professional counselor and owns a private practice up in Maryville, Missouri, called Compass Counseling Center. Her research interests include topics of interactive learning in college setting, mentoring and supervision, grief and loss, age transitions, creative counseling interventions, and some stigma reduction. She also teaches several courses at Northwest. And thank you, Elizabeth, for being here today as well.
Yeah, thank you. I'm glad to be here. And I hope everyone is looking forward to some relaxing downtime with us. And we're going to share with you a little bit about the work that we do at the university and more about what stress looks like. So let's go ahead and get started. So today we're hopefully going to be able to identify what stress is and how stressors impact our life. We're going to inform you about what's kind of happening within your physiological system, what's happening inside the body while stress is occurring. How do you kind of differentiate fear, anxiety, and panic? How do they look different, and what's actually happening? And then kind of looking at what's normal anxiety, and then when does it become abnormal or become what we call a diagnosis. And we'll kind of go through what some of the core features are of a few different anxiety disorders. And then hopefully we'll be learning a few tips and tricks to coping with anxiety as we go along. But most importantly, hopefully you'll have fun. So my hope for you is that during this time together, that you will let us know if you have questions, if we can expand on anything, answer anything, we would be happy to. I do have a quick disclaimer. This is not for mental health assistance. It is not a counseling service. It is more an educational opportunity. So if you do need assistance, please contact your counselor or your local mental health agency, and or if it's an emergency, 911. But let's move on and start with something kind of fun. So A lot of times people think when I say, hey, let's do some art, they go, oh, no, I'm not an artist. And actually their anxiety goes up really quickly. And so we're going to actually just, no one's around. Nobody will see your work. You can share it if you want to in the comment section or in the chat. But we're going to just start with scribbling. Scribbling's pretty easy. Anybody like a 3-year-old scribbles, right? There is no right or wrong way of doing it. You can't do it too much or too little. There's no right or wrong. So what we're going to do is some scribble art. And when we do scribble art, you can do it in many different ways. So you can just do a scribble all around, and then maybe you write some feelings that you're having in each of the different blocks. So one of these is silly. I'm being playful and drawing and doodling and coloring. One of them is maybe relaxed because I just did this new breath work that we're going to do. Maybe one of them is tired and sleepy and I just want to just chill out. So you can do it that way. You might do a scribble like this, where you kind of create a circle or a shape on the outside, and then inside you just kind of swirl around, and then you can just doodle away. And in the end, it becomes almost mandala-ish, and creates this ability to get out of your own way and just enjoy the moment. You can doodle like this. I just did this in the last 2 minutes while we were talking before we started up. And what I did is I just scribbled, and then I kept turning the page until I saw something, and I saw a duck. And so I got out some of my oil pastels and just started playing and drawing the duck. So there's no right or wrong way, but what I'd like you to do is see if you can grab a pencil or a pen, some paper, and just while we're talking, just scribble and see what happens. All right, so while we're doing that, I want you to think about the stressors in your life. Okay, so what are those top 3 things? If you were to say, call up your best friend and say, I'm stressed about blah, 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 what would they be? You got them? I bet they kind of pop into your head really fast, because most of us can identify the things that are kind of creating that repetitive thought in our mind, or that uncomfortable feeling in our gut. A lot of those would be work stress, finances. I have a project due. I am having some relationship issues. I'm separated from someone that I love. Maybe it is some kind of transience where my housing is not the same as what I had anticipated it being. Maybe it's sometimes we live in a culture of stress where, it's almost like a badge of honor if I say I'm really stressed, right? And so we just have these things that kind of are normal everyday things. And so we have these what we call eustressors, and we have distressors. And eustressors are kind of these positive things in our life that still create this heightened arousal in our system. And so that might be, I'm getting married, I'm going to have a baby, I'm graduating, I got a new job. All of those are really good things that we're happy about. And yet they still create this anticipation or this worry about what's to come. Okay. We also have distressors, which like are car accidents or traumas or exams, where you're not really looking forward to any part of that, but it still, again, heightens that system. One of the big stressors that a lot of people have in their life is actually this idea of success. That can be really stressful, or the idea of failure. So there are many things in our life, events, situations that then amp up our physiological system, making us become more aroused or are ready to react. And when we talk about health psychologists, they'll often say that if we're in this heightened level of stress for an extended period of time, it can actually be really bad for your health. But part of that may be how we view stress too. So if we view view stress as a negative, as something we have to tackle, then it can amp up our system more than if we just see, oh, this is one more exciting thing I get to do. We also have people that just are naturally a little more anxious. When we're babies, as some of you might have been lucky enough to have that baby that's just super easygoing, and you can pass them around to anyone who comes over, and you can mess with their sleep cycle and they're fine. They don't have a lot of upset with that. When they do get upset, they're easily calmed. And then there are babies that are a little harder to navigate those changes. Like, you don't mess with their sleep schedule, or their whole day is out of whack, or they don't want to be passed to anybody besides mom and dad. It kind of elevates their arousal system. Okay. So some people have this idea of negativity and stress. Some people have this innate trait of stress, and some people have a more biological response to stress. And so we're going to hear a little bit about that. But first, we want to kind of differentiate what that anxiety is, what a stressor is, and what fear and panic are. So a stressor is simply an event that happens in your environment that gets that system aroused, okay? We can have a fear response, and fear is actually when you are having this fight or flight reaction in the presence of immediate danger. Meaning, say I'm walking home from my work, and it's dark, and all of a sudden, out from behind a tree jumps a man with a chainsaw. No, right? Okay, and and you go, ah! Now you literally will probably run. Or if you're me, I'm not very fast. So I'm probably going to chuck my briefcase at them, or try to kick, or do something that is in a fight response, and then I'll take off trying to run. But it's in the presence of immediate danger, all right? It makes sense. We want to have fear. It's a good response. Anxiety is in response to something that could happen, or maybe will happen in the future. So maybe when you're at work tomorrow and you're thinking about going home, and you say, gosh, I remember that lady last night talking about the guy with the chainsaw. Now, what if someone actually jumped out at me? What would I do? Do I need to get my pepper spray out? Do I need to carry my keys a certain way? Do I want to have my whistle? And you're kind of thinking through what you might do. That's anxiety. Anxiety can be good, and it can be unhelpful, right? So we want to have anxiety when we're preparing for a test. It makes us study harder. It makes us choose to go to bed instead of going and having a beer that night. It kind of helps us to prepare when you're getting ready to run a race. You want to be a little bit elevated, right? But it can get to a point where it's overwhelming too. And sometimes that's when panic happens, when you actually are kind of flooded in your system, and you, instead of fighting or flighting or figuring out the future, you then freeze. And you kind of get stuck in that moment. So the guy jumps out behind the tree with the chainsaw, and you go, ugh, and can't scream, or you wet yourself, or you're like, I'm just done. Just go ahead. You just don't know what to do. Okay. And so panic is really this adrenaline flood that rushes through your system.
And so no matter the result of the stressor you're experiencing, whether you are having anxiety, whether you're having panic or fear, the physiological response, that adrenaline rush that Elizabeth mentioned, it's all the same, no matter what. And we didn't know this until about the 1930s, when a guy named Hans Seeley came along. He was an endocrinologist. And in the 1930s, he was looking for a new hormone. He was trying to discover a brand new hormone. He was a very ambitious guy. And so he had a lab, and he would take his lab rats and inject them with a ovarian extract. So basically, his idea was, I'm going to inject them with one type of hormone and see if I can isolate a novel hormone that nobody's ever seen before. So he started out with ovarian extract, and he would inject his rats with this ovarian extract over a period of weeks. And then he would document how they did. Well, what Hans Seeley noticed in his rats was that over a period of time, they developed what he called a triad of issues. So 3 physiological issues all of these rats shared following their experimental treatment. The first of which was bleeding ulcers. These rats just developed these bleeding ulcers in their stomach and other areas. Additionally, they had shrunken thymus glands. So the thymus is part of the endocrine system, and it's tightly coupled with the immune system because the thymus actually produces lymphocytes. And lymphocytes are our body's disease-fighting cells, basically. So they help fight off antigens in our body. And so these rats, after being in this experimental study, had shrunken thymus glands. So presumably their immune system wasn't working very well. And additionally, they had enlarged adrenal glands. Adrenal glands are another endocrine gland. They sit on top of our kidneys. And so in these rats, their adrenal glands were enlarged. And the adrenal gland's job in a rat and in a human is to produce stress hormone. It actually puts stress hormones like adrenaline, noradrenaline, and cortisol into the blood to circulate throughout the body. And so Hans Seeley, because at first he'd only tried one type of injection, those ovarian extract injections, he wanted to make sure that it wasn't something else that was causing this triad of issues, because he didn't want to just conclude that it was just the ovarian extract. So he actually tested other substances on these rats, including placental extract, kidney extract, and he even had a placebo or control group where they just injected saline into these rats. And no matter what injection the rats had, they still presented with this triad of physiological ailments following their participation in the experiment. So I want us to think about this from the rat's perspective, or even as somebody, imagine you as a child going to get a shot, for example. It's pretty stressful, right? Especially when you're little and you don't really know what's going on. Well, that's kind of what happened with the rats too. And back during the 1930s, we didn't have an institutional review board that made sure people were treating the rats humanely. So unfortunately, these rats were not treated very well. And what Seeley concluded is that it wasn't the injections at all that were causing this triad of physiological issues. It's actually how stressed out the rats were from getting the injections over time. I mean, Hans Seeley even had in his personal diary how, these rats, after knowing what the injections were, they would try to scratch out of his hands and he would drop them and have to chase them around the lab. I mean, these rats were just super stressed out. And so Hans Seeley, he concluded that that was the cause of their triad of issues. And he called this triad general adaptation syndrome, which today we just term as the good old-fashioned stress response. Our stress response involves the endocrine system. And it's really important to note here that our body has a non-specific response to stress. So like I said previously, no matter if you're anxious, fearful, panicking, whatever it may be, and whatever the stressor is, if you're sitting in traffic or running from the guy with the chainsaw, your body is going to engage in the same physiological pattern of behavior, and this is called our stress response. And this stress response is initiated in our brains. So it starts out in the brain. We perceive the stressor, and we do this in an area of our brain called the limbic system. Now, this limbic system is very centrally located in the brain. It's our emotional brain, really. That's what people call it. This area is highly responsible for our experience of emotion, negative and otherwise. And so stress is first perceived there, and then that limbic system wakes up the endocrine system. So we perceive the threat. And then the endocrine system is cued in on that, and a cascade of physiological responses are going to occur. So imagine you're walking through the woods along a wooded path, just enjoying a nature walk, and you come across a bear. You see a bear. Well, your brain perceives the bear first, and you think, ooh, this bear looks hungry. It's probably going to eat me. I need to either run from this thing or be prepared to fight it, right? So it's making me very anxious that this bear is along my path. So your brain picks up on the stressor, and then it tells your endocrine system, hey, we got to be ready to either fight this bear or run for our life from this bear. And so that's where the endocrine system comes in. The endocrine system actually influences a branch of our nervous system called the sympathetic nervous system. And so this branch of the nervous system is basically where fight or flight comes from. It turns that on. So again, we start in our brain in the limbic system. We see that bear, we're scared. There are endocrine glands near and in the brain that are going to initiate some endocrine responses. It's actually going to wake up what we call the sympathetic ganglion chain, and it's literally just neurons, attractive neurons that runs down our body that comprise our sympathetic nervous system. So it turns that chain on, and this chain innervates our adrenal glands, which are another endocrine gland. And so the sympathetic nervous system, it's going to activate those adrenals, and then these adrenals are going to pump out stress hormone into our blood. And this stress hormone, adrenaline, cortisol, and particularly adrenaline, is going to impact our physiology in a way that's going to help us run away or fight the stressor. So when we have adrenaline pumping through our veins, essentially what happens is our heart rate increases, okay? When we're trying to fight or run away from something, we need that blood available to our heart so it can pump. So our heart starts pumping faster to get more blood available. Or as a result, our blood pressure goes up. Also, we start to breathe faster because our bodies need oxygen as well to help our muscles allow us to navigate this threat that we've perceived in our way. Additionally, our pupils even dilate of our eyes. And this is really cool because it's actually allowing more light in your eye, and with more light, that means we can see more, and so it allows you to better see what's around you in that threatening situation. So adrenaline does all of these things in preparation for you to navigate this threat. And again, this is this fight or flight response, our body's way of preparing to confront or essentially flee. And so I like to use this example. I don't know if any of you have seen the Pirates of the Caribbean series, but we have Jack Sparrow here in a series of stressful situations. So no matter the stressor that Jack is experiencing, his stress response is going to look exactly the same. His adrenaline is going to be pumping, his heart rate's going to be up, his pupils are going to be dilated, no matter if he's fighting the British Army, trying not to get arrested, right, and taken to jail and presumably hung for piracy. His stress response is going to engage when he's running from cannibals on a native island who want to eat him. And also, he's going to have a stress response, adrenaline, all of these things, when he's having a disagreement with Captain Balboa about who's going to get the Black Pearl. So all of these situations, two of which are life-threatening, one is not, in all cases, we have this stress response, this upregulation of adrenaline and stress hormone in the body. And as a result, stress can be bad for our health. And Elizabeth mentioned this just a few slides ago. Chronic stress can definitely impair various aspects of human function, including appetite, sexual desire, energy levels, and immune function as well. It can actually kind of wear out the immune system. But stress is not totally a villain either. Research has shown us that brief stress is actually really good for us in cases. And by good for us, I mean it actually, in short, brief, acute spurts, stress actually upregulates our immune system. So it upregulates the cells and cell products like lymphocytes, for example, and other inflammatory markers and things like that will help fight off any antigens that we might encounter in that stressful event. So imagine again our bear scenario. You've seen the bear, and maybe it attacks you, maybe it tries to maul you. So imagine you're going to have some skin tearing, right? And the bear might have scratched you or bit you. There's going to be germs in that scratch, right? Saliva from the bear, whatever it may be. And so that upregulated immune response actually helps your body not go into toxic shock, for example, or at least fights against that, because that immune system is upregulated. But over time, if we're continually stressed and that stress enters a more chronic phase, that immune system basically just peters out, it wears out because it's been upregulated for so long, it's just worn out. And so if any of you have had school-age children, especially when they go to college for a semester and they've been stressed out all semester, and then they come home, and that first week they're home, they want to just stay in their room, and they might even get a cold or something. They've been stressed, and their immune system has kind of just, kind of petered out for a moment, and they have to recuperate from that. So stress can be good and bad. And stress, too, when we're stressed out, we can, especially when we find ourselves in a perceptually stressful situation, maybe we're sitting in traffic or, waiting on some news or things like that, and we feel that heart rate go up, we feel that sympathetic nervous system kick in, we can feel our blood pressure go up, and we're breathing rapidly. We can actually slow down that sympathetic nervous system response, that fight or flight response, by breathing exercises. Is something as simple as breathing. And so Elizabeth's going to walk us through this in a minute, but I wanted to kind of talk briefly about the biological mechanisms behind why this actually works, because you may be thinking, oh, breathing, how does that really help me? Like, I breathe all the time. Why would this reduce my stress? Well, if you breathe in a certain pattern, it will actually somewhat turn off that sympathetic nervous system response and actually activate the sympathetic nervous system's counterpart, the parasympathetic nervous system. This is called the rest and digest system. So it's absolutely opposite of fight or flight. And so if we can turn this system on to some degree, our heart rate's going to decrease, our respiration rate's going to decrease, our pupils are going to relax, our muscles are going to relax. And so this will help reduce that stress, and ultimately our body producing more stress hormone, pumping more into the blood. And so when you do these type of breathing techniques, I call it a physiological sigh. I believe we can also call it diaphragmatic breathing as well, because we're really utilizing the diaphragm in this particular breathing exercise. And why the diaphragm is important in this is because when we take a big, deep breath in, we actually enlarge our diaphragm, and our diaphragm actually presses on our heart. And when we're having a sympathetic nervous system response, our heart is pumping rapidly. It's pumping all of that blood into the heart. That heart becomes engorged with blood. That diaphragm being inflated is actually going to push that blood out. And as a result, your heart rate goes down. And so just by taking a few of these calculated breaths, we can actually slow down the heart rate, which tells the brain, hey, we're actually not as stressed as we think we are. We can kind of relax now. Additionally, when we do calculated breathing, like this diaphragmatic breathing, it helps introduce extra oxygen into the body. And so think about it, when you're really stressed, you breathe a lot, your respiration rate goes up, and those breaths often become shallow over time. And as a result, you don't have as much oxygen in your lungs, which of course goes into your blood. And so with that lack of oxygen, that also puts stress on your body. It actually keeps that stress response kind of going. So if we take deep breaths and really inflate our lungs and inflate the air sacs in there, that is actually going to knock out that extra CO2 and give us a boost of O2 that we need to relax. So Elizabeth, would you like to walk us through one of these breathing exercises?
Sure. And these not only help you to relax, but they also allow your brain to work more clearly, because when you're at that heightened level of stress, you are just like react. And what we want to slow down and say is, okay, let's problem solve. Let's think about this from multiple different areas. So What I'd like you to do is put one hand on one shoulder and then put your other hand on your belly. If your hand on your shoulder goes up like this, we're breathing wrong, because then you're breathing in through your chest instead of in through your diaphragm. We want your belly to go out. So when I work with kids, I call it belly breathing. And it's like we're filling up a balloon as full as we can. So we're going to take 2 breaths in, and it should be your belly both expanding. And then we're going to take an equal or more intense breath out that is elongated. So we're going to go just like you're kind of stretching that balloon out, you know. Okay. Now you want to do at least 3 of these at a time for your system to really go, oh, okay, wait, I know what she's doing. I know what he's doing. We're trying to calm down at this point. Okay. So let's try that again. Hand on your belly should be going out. Hand on your shoulder should not be going up. Ready? Last one. And already you can probably go, okay, yeah, I get that. Your body starts the shift into a new way of being at that moment. Well, so we've talked about normal stress. We all have it. Everybody experiences stressors. Everybody has those heightened elevations in their endocrine system and how their body is kind of reacting to those stressors. That is normal. So when does it become abnormal? Because we've all heard of anxiety disorders. It becomes abnormal when you have 4 Ds. Okay. So our first D is it starts deviating from the norm. Most people aren't feeling this way, or they're not experiencing that level of stress, or they're not experiencing it for that long. So it's kind of starting to like, most people might say, oh, that's not how I feel. Other people, the other D is when you start feeling distress. So that might be like this uncomfortable feeling, right? That yuck in your gut, or just this, I can't quite settle down, and just not feeling right. Another D might be it's creating some kind of dysfunction in your life. So you're not eating the same as you were. You're not sleeping well anymore. You're not being able to concentrate at work. Your relationships are getting complicated because you're more irritable. It's creating some kind of dysfunction or in your life. And then it also can increase the danger. So if you're not sleeping well and then you're driving, maybe you're not as careful, your reaction times are not as quick as they would otherwise be. Maybe it gets to the point where people start thinking about hurting themselves, or they're having what we call suicidal intensity. So there's lots of different dangers that can come up, some that we might think of as more benign, and then some that we might think of as pretty immediate danger. Regardless, when these 4 Ds come up, we might start saying, that might be more of on the abnormal side, or what we call a disorder. Okay. So let's talk about some of the disorders that have anxiety kind of surrounding them. The first one is generalized anxiety disorder. This is probably our most common anxiety disorder, particularly in America. When we have generalized anxiety disorder, what happens is you start thinking of maybe those everyday stressors become really big. They kind of multiply or snowball, if you will. So I might have been running a little bit late for work, and I have my cup of coffee in my hand, and shoot, the rain was coming down, and I'm like, oh, now I'm going to be late for work. And my hand slipped on the coffee, and guess what? My coffee spilled all over my pants and all over my car. So now I have to run in and change my pants. I'm going to be late for work. And now what if my boss is mad at me? And now what if my car smells like coffee? And now that's going to cost me money to get my car detailed, and everything kind of gets bigger and bigger and bigger. And it just builds on each other. So what might be like It's a spilled cup of coffee to one person becomes this really big event for another person. And it's not just this one time. What we see is that this person has a pattern of this kind of thinking for at least 6 month period of time. So this ongoing elevated stress about stuff that maybe other people might think as minor. I didn't get the birthday card to my best friend in the mail. I said that thing and maybe it was misinterpreted. And now what do I do? Can I even talk to that person again? And we just get all worried about these maybe more minor things that other people are just like, oh, yeah, I didn't even think about that. And not only do we worry about them, maybe we find it difficult to control that worry. So somebody says, that's not a big deal. Don't worry about that. Well, I guess what? You just told them something's wrong with them because now they're worrying about something they shouldn't be worried about. And then they get amped up about that too. So these folks tend to feel kind of keyed up or on edge. They kind of feel maybe more irritable. Sometimes they feel like they have a lot of muscle tension. They could really use massage. Couldn't we all, right? Maybe they're just not sleeping well. So they go to sleep and they wake up going, oh, shoot, I need to do that and this and that. Or maybe they're having a hard time going to sleep in the beginning. So just kind of always on edge. This has actually become, like I said, much more prominent in the last couple of years. But we have a society where we are a go, go, go society. So we don't really do ourselves any favors because remember, we live in that culture of stress where it's almost encouraged to feel that way. If we do another activity to kind of learn a skill, there's guided meditation. Now, many of you may have used guided meditation before. You might have heard of like Headspace or Calm. There's so many different apps out there, some of which are free. Some you can, they will take you to certain places. They might have certain music. This one, I want to go to the beach. That's one of my favorite places to go. I got married on the beach. I'm a big fan of the beach. And so will you go with me to the beach? What we're going to do is we're going to start with that diaphragmatic breathing. You can put your hand on your belly where you can just remember I need to be poofing my tummy out and leaving my shoulders down. And you're going to take those 2 deep breaths in. And I'd encourage you, if you feel comfortable, to close your eyes. You continue that breath practice as I paint a picture for you. So what I want you to think about is putting your toes in the sand. And it's that really soft sand, very, very white, where your feet just kind of sink down into it. And you take a deep breath in. And you smell that salty air. And you feel the warm sun on your skin. And you hear the waves coming in and out. And in and out. And you find the perfect spot in the sand and you either spread out your towel or maybe you just sit on down. And you run the grains of sand through your hand and just let them sprinkle out onto the ground. And as you notice that, there's a seashell sitting right there, and you pick it up while the cool breeze cools your skin. And you inspect the seashell. You notice the grooves and bumps on the one side, all of the colors. And when you turn it over, something different, smooth and has its own unique picture, its own color. And you wonder, where has this shell been? Who has resided in it? And you're grateful for this treasure and all that surrounds you, all that has been and all that is to come. And you notice that you have a drink sitting right beside you, your favorite drink. Makes your mouth water. And you take a long, slow sip and savor every little taste. You look back over the water and see how the green blue of the ocean meets up to the blue of the sky. And you think all is calm and all is good. And when you are ready, you can open your eyes and come back from the beach. Now, some of you may have said, I absolutely hate the beach. I do not like sand in my toes, and that would be fine. So you would not do this guided meditation. You would choose to go to the mountains, or you would go to your bedroom, or you maybe go to a field, wherever you want. Guided meditation is just simply to put yourself in where you can use all your senses, and you can focus on calming that system and being in a space that feels safe and well for you. Let's talk about another psychological anxiety disorder that is out there. And that is social anxiety disorder. So social anxiety disorder is a very common disorder, and it's actually become more common in the last 2 years, particularly during pandemic. Because we have become so used to being by ourselves that being around people can be difficult. Now, here's the kicker about this. This disorder is not actually about being shy. It's not about having a hard time being around new people or people in general. It actually is about the fear of being humiliated, embarrassed, or judged in some way, shape, or form. And when we were kind of holed up in our own little worlds, we didn't have to experience that as much. And now that everybody's kind of starting to reintegrate into society or into our social groups, people are having a harder time going, what are people going to think about me? And do I know what I still know? And they're really conscientious about that probability of embarrassment. This can be for specific things. So it can be the possibility of being embarrassed while giving a speech, or it could be a concern that is more broad. So, like one person that I worked with. I was so anxious that he didn't even want to call the doctor's office because the receptionist may judge him. Now, he didn't know the receptionist, probably would never meet the receptionist, but that fear of judgment was so powerful that it actually kept him from seeking medical attention when he needed it. So these fears of being judged can then lead to a panic attack. So you've maybe seen somebody when they're giving a speech and like the red just kind of creeps up their neck, or they start not being able to quite breathe right. So panic attack is when you start getting tunnel vision and maybe your heart starts racing. And a lot of people actually, when they have a panic attack, think that they're dying, that they're actually having a heart attack. But what it is their system is just simply flooded. And if they can take a minute and calm themselves, then surprisingly, they tend to be okay. Now, I will tell you, most of us are actually going to have a panic attack in our life at one point or another. It's actually a fairly common thing. That doesn't mean that you're going to have social anxiety disorder or that you're going to have panic disorder. It simply means this is a symptom of one of these disorders. It's just one little component. Once they have this, they'll a lot of times start avoiding the situation that causes them anxiety. So if I'm terrified of giving speeches, I'm maybe going to completely avoid a job if I think that I'm ever going to have to give a speech there. If I am really worried about being in front of a group of my peers, maybe I start avoiding going in social situations like that. Again, it's very different than being shy or being introverted. It's more that fear of embarrassment or humiliation. Let's go on to our next one here. So we have another exercise that I often, or a coping skill that I will often teach folks. It's called grounding. You can do this in many different forms. I'm going to teach you one called 5, 4, 3, 2, 1. You may have heard of it before. What you're going to do is you're going to look for 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste. What it does is it kind of takes all that big stuff and it says, whoop, I'm honing in on just this moment. I'm sitting here, I'm being right now, and I'm focused on only that. And it kind of, again, calms that system down. So I have a picture of a lace curtain on here because when I was doing this with a gal one time, I asked her to practice this, and she came back and she told me how she noticed the lace curtains, and there was one little flaw in the lace, and she noticed how the breeze was blowing it, and she could see the horse and the pasture outside of it, and she could see the frame of the window pane. And so, I mean, like, it's really detailed, and very quickly your system just goes, because all of those other things that were just swirling and swirling in your head now go, oh, that's not the important stuff. I'm zoned in on this. So you might try this another time. I don't want to spend a lot of time on it right now because this is a practice that as long as you remember your 5 senses, you can do this one. There's another stress disorder. It's there's anxiety disorders and then there's stress disorders. Stress disorders have to have some kind of trauma associated with them. So some kind of life-threatening event that could be a flood, it could be a tornado, it could be a sexual assault, it could be a car accident, it could be an act of war. We could think of so many different things that could be considered trauma. And when we have these traumatic events happen, our system kind of goes into that heightened state for an extended period of time. And so then people start having certain responses, like they might kind of feel numb, like, how are you feeling? I don't know. I don't know. Are you okay? Are you angry? Are you sad? I don't know. I don't feel anything right now. They just kind of feel numb. They may not be so much aware of their surroundings. So one gal that I worked with, she would get so overwhelmed, she would jump in the shower, and then she would stay in there to the point where she would forget that the water had turned cold, and so she was in this freezing cold water. So she just kind of didn't feel her surroundings. Sometimes you might walk through a situation and you can go, gosh, it just feels like I'm watching myself walk through this. This doesn't even feel real. So there's lots of different ways. You may just like forget a piece of the trauma. Like I don't even remember that section. You may have other things like some kind of re-experiencing of the event. So you might have what we call flashbacks. That's where you actually feel like you're back in that moment again, re-experiencing everything. Other times it might just be like pictures flashing in front of your face and you can't stop the pictures. It may be dreams, and the dreams are so vivid, you feel like you're back there again. some kind of re-experiencing of that. And then you also are likely to have some kind of avoidance of the event. So if I was in a car accident, I don't want to go around that corner again. Or maybe I don't even want to get in the car again. If it was, I lost a loved one, maybe I start kind of pushing back and don't want to be around people that I love because I might lose them too. Sometimes people avoid by drinking and kind of numbing themselves with alcohol or drugs. Just some kind of avoidance of the stimuli. One person that I worked with had been assaulted, and her attacker had cinnamon gum in his mouth. And so she would avoid anyone who was chewing cinnamon gum. She would just she would just walk away from them. So some kind of avoidance of the trauma, and then also likely some kind of increased arousal in their system, not only with the adrenaline, but what we call hypervigilance. So they might be super aware of everything that's happening in their room, or somebody comes up and touches them on the shoulder and they have that really big startle response, or like, I'm going to turn around and pop you. So they're kind of have this increased arousal. Now, a lot of you may be going, well, that sounds like PTSD. Surprisingly, it actually is pretty much the same as PTSD, except acute stress disorder is actually a way that we say, yeah, it's really kind of normal to have these responses, but let's kind of see if we can slow our system and address that trauma now before it turns into PTSD. So it's within 2 days to 4 weeks of a trauma, and then PTSD is actually within after 4 weeks, it would turn into PTSD. And it doesn't actually have to start right after a trauma. So you might think you're totally fine. And then, 2 years later, something really triggers you and reminds you of that trauma. And then all of these symptoms may start coming on. So these are just like a few of the anxiety disorders and stress disorders that are out there that are connected to that heightened elevation in your system. Another is specific phobia. Now, our specific phobia is actually when you have a real fear of one specific thing. So many of you might say, oh, I know arachnophobia. I have total arachnophobia. So a fear of spiders. But there are so many different specific phobias. The most common are animal type phobias, snakes, dogs. There's one of naked mole rats. That's not a real common one. Natural environments, heights, storms, floods, things like that, tsunamis. There's blood injection type. So going and getting COVID shot for somebody who has a specific phobia of that can be really difficult and challenging. Others are situational ones. So there's actually a phobia of the dark, a phobia of enclosed spaces, of elevators. Those are very common ones. Less common ones are of the number 13, or of peanut butter being stuck to the roof of your mouth. There's one of a fear of shaving, and then there's a fear of facial hair. So it's really a rough one if you have both of those. But it's one specific event that causes that panic, that panic or physiological response. And then a lot of times they'll avoid those things. So if you are really freaked out by bridges, you will find all these different paths to work that you do not have to cross the bridge. And then if you have to cross the bridge, that kind of complicates the situation. So a lot of people with a phobia might say, well, I'm terrified of flying, so I'm never going to become an international business person. But then say, what if their kid wants to go get married in Hawaii? Are they going to face it? So a lot of people can actually manage a specific phobia better than they can a lot of these other anxiety disorders, because this is not every day in their face. They figure out a way to make it not as invasive. It's only, a lot of people will treat this only when it becomes something that is really starting to get in their way and their life in some way, shape, or form. And that's the thing with all of these disorders is they have to affect one or more areas of your life. They're affecting your family, they're affecting your friendships, they're affecting your work, your education, your health. Some way they're having some kind of negative impact on your life. With specific phobias, you can get them because you learned to be afraid of them. So one of my friends was very afraid of dogs. They went on a walk. She went on a walk with her kids, and her phobia came from a trauma. She was jumped on when she was little from a dog, and so that trauma increased this specific phobia response. Well, then when she was on that walk with her kids, a dog came charging up towards them, and instead of staying calm and saying "bah" or "sit," she starts running and goes, "Run, kids!" Right? She took off, and these kids were like, "Ah, what is happening?" And so they actually learned to have a phobia. You can also be evolutionarily predisposed to having a phobia. So we know that people have died from snake bites before. So maybe we have a phobia of snakes because there's a good reason to be a little bit hesitant or nervous around snakes. So I guess the kind of question that we come to now is what happens when we have some of these situations going on. There are lots of different treatments available. We have what's called cognitive behavioral therapies, and that's where you look at your thinking and your behaviors and how those are impacting your emotion. And you can tackle either your thinking or your behavior or both. And in turn, it's going to change the way that you feel. So I might start a new mantra. I am enough. I am enough. And so I write on my mirror, I am enough. And over while I go into the restroom each time that day, I'm reprogramming my brain, which then changes the way I feel. I feel like, oh, okay, now maybe I feel a little bit better. Now, does that fix everything? Maybe not, but it does change the emotional state that I'm in. You can also change your behavior. So if you're so super stressed and you're noticing that you're irritable, maybe you sit down and you write 3 things that you're grateful for, and it kind of just changes that perspective. So my action of journaling is changing the way that I think, which is changing the way that I feel. You can also do what we call systematic desensitization, where you kind of slowly expose yourself to a stressor, and you pair it with a calming situation. So maybe when we're really stressed out, we do some progressive muscle relaxation, and we think about that stressor. And so what we're doing is we're calming our system while that stressor is in our forefront of our mind. Or we might have that stressor and we start doing that diaphragmatic breathing, or we think of that stressor and we do some yogic practices. So it's kind of all slowing that system back down so that now that stressor is actually paired with a calming sensation. We can also use medications.
Yeah, we can use medications as well. And medications are useful to treat anxiety disorders to a certain degree because pretty much throughout all the anxiety and stress disorders, what we find in terms of the brain and chemicals therein is that folks that suffer from these types of disorders, they typically have lower serotonin levels in their brain. Serotonin is kind of your feel-good chemical, and it makes you feel happy. And so one of the most effective drugs to treat anxiety type disorders are SSRIs, or selective serotonin reuptake inhibitors. So essentially the mechanism for this drug, say you have a type of anxiety disorder, you're low on serotonin tonically in the brain. Well, when you start taking an SSRI, what happens is the SSRI blocks the cells that would suck up the leftover serotonin in your brain. And so basically what happens as a result is there's extra serotonin left around in your brain to have a happy impact on your brain function, on your mood and things like that. So it's been shown to elevate mood. So SSRIs are predominantly used to treat anxiety disorders, although some of you may be familiar with certain benzodiazepines that are used to treat, we'll say, acute anxiety. So maybe you do have anxiety attacks from time to time, and maybe you have a script for Xanax, for example. Xanax is a common benzodiazepine. Benzodiazepines are depressant class drugs. They're a psychoactive drug that depresses the central nervous system, and they're considered anxiolytic, which means they reduce anxiety. But even though that's what benzodiazepines do, overall, those SSRIs are actually more effective in the long term of kind of mitigating that anxiety or symptoms related to anxiety disorders.
Yeah, another thing is just really getting some education, understanding what is happening in that system, understanding how to slow that system down, knowing what resources are available to you. There's a ton of research out there about the benefits of nature, how our system slows down, calms down, our thinking becomes more clear, our breathing becomes calmer, our heart actually becomes healthier, being out in nature. So going on hikes, on nature walks, just actually going and just sitting out by a pond, all have very healing properties for anxiety and other mental health and physical health issues. Diet, we know that when we put a lot of processed foods in our body, that can impact how our brain is processing things. And in fact, a lot of our serotonin is in our stomach. And so the food that we put in impacts that feel good chemical that Amy was just telling you about. We can also do mindfulness, meditation, yoga, art. We actually just had an event on campus that we worked on with our Behavioral Sciences Association called I Will Listen. It's through the National Association of Mental Illness, NAMI, which is a very large scale organization that works to help reduce stigma around mental illness. And what it was for is just to say, everybody deals with some kind of stress. Everybody is dealing with something. And if we are open enough to really slow down and hear them and listen to their stories, that maybe they'll feel a little bit better. And so what we did is we gathered artwork from our elementary community, our middle school community, our high school community, our college students, and then some of our faculty, staff, and further out community. And we just were able to showcase what people were experiencing and kind of a little bit about their story. And it was very eye-opening to a lot of people that, gosh, people think this deeply and feel this strongly. And this is another way to communicate instead of just always because I know, like, I get tired of hearing myself talk, and sometimes, I don't know about you, but it's actually just hard to put things in words. So if we kind of look at how art impacts our well-being, it actually helps to kind of externalize our emotions. So all this stuff that's going inside, going on within ourselves, gets out. We have a safe distance. So a lot of times when I'm working with someone, or if I have to talk about something hard, I'll be doodling and drawing while I'm doing it, because it gives me something else to do, which allows my brain to actually be clearer in what it wants to express. There's also a lot of other therapies that can kind of be integrated in with art. And a lot of times it just makes people feel a little bit more comfortable. If you haven't been to the Glore Psychiatric Museum, hopefully most of you have if you're on this site, then you would see that they have some wonderful exhibits of how people have expressed their internal struggles in an external way through art. And the Kemper Museum has some beautiful artwork, oftentimes displayed from artists who are also having internal struggles. So I would encourage you to kind of look back at your doodle, if you will, or your scribble, and say, what does this mean to me? Does it mean anything? Maybe it was just like, a way to calm my system. Maybe it does say something. Maybe I just kept drawing the same shape over and over. Or maybe I drew this really intense picture. What does it mean to me? Nothing is wrong. Nothing is bad. All of it is good. It's a strong investigation of self, and it allows you a new way of seeing who you are and what you're feeling and experiencing. So maybe it's not you that's struggling. Sometimes we have friends that are struggling. And I think the key with that is just really being an active listener, making sure that you're trying not to judge them, and then connecting them with resources, kind of being that stable home base when they are maybe in a rough place. I think those are the keys to helping any friend, is being that stable base and having that really strong active listening. So I hope this was informative. I hope we kind of checked off those goals that we started with. But what we would like to do is open the floor for any questions that you might have. You can throw them in the chat. You can turn on your cameras. You can ask out loud, however you want to do it. And we'd be happy to answer any question that we can. Sarah, did you see any questions in the chat at all?
There's none on our Zoom. I'm refreshing our Facebook Live right now because I know we have a few people on there.
Okay.
While we're waiting, I made a doodle of my dog.
Awesome, doodle dog.
That's awesome.
Yep. She's in front of me, so.
I would love to see anybody else's scribble arts or doodles that they did during the presentation too. That was a lot of D's there. Did you hear that?
A lot of D's. Oh, we do have one comment. Let me pull it up in a second. Oh, no, Olivia Smith just said, thank you so much for the presentation.
Well, thank you.
Joining us, Olivia.
Hope you enjoyed it. It was fun to do.
Yeah.
Lots of good information and resources for everybody.
All right.
Good.
Well, thanks for letting us be here, Sarah. I appreciate it.
Yeah, thank you so much.
Our next Psychology Social Hour will be June 24th with Dr. Chase Owen also from Northwest. He'll be talking about the history of mental illness and some diagnoses over time. So we look forward to seeing you guys then.
All right. Take care.
Thank you.